Hi, my name is Dr. Karen Sue. I'm a pediatric endocrinologist who specializes in adrenal steroid disorders, and I'm the medical director of CARES Foundation. I'm here today to talk to you about adrenal crisis in the emergency setting. CARES Foundation is a nonprofit organization that provides support to individuals and families affected by a potentially life-threatening form of adrenal insufficiency called congenital adrenal hyperplasia, or CAH. Through our members, we have seen the physical, emotional, and financial trauma that can occur when individuals with adrenal insufficiency do not receive immediate, appropriate medical care in times of illness and stress. I'm going to start with a review of the adrenal anatomy and physiology. So the adrenal glands are endocrine organs that sit on top of each kidney. This is a cross-section of the adrenal gland. The cortex is the outer part, and the medulla is the inner part of the adrenal gland. The cortex is responsible for producing our essential glucocorticoids, mineralocorticoids, and androgens. The primary glucocorticoid produced by the adrenal gland is cortisol, and this is essential for maintaining blood pressure, heart tone, muscle tone, as well as maintaining blood glucose levels. The primary mineralocorticoid made by the cortex is aldosterone, and this maintains salt balance and blood pressure. Adrenal insufficiency is a group of conditions whereby affected individuals do not produce the life-sustaining adrenal hormones like cortisol, placing them at constant risk for an adrenal crisis. Adrenal insufficiencies include, but are not limited to, congenital adrenal hyperplasia, Addison's disease, patients with pituitary gland deficiencies, and any patient who is on chronic steroids for other conditions such as rheumatoid arthritis, asthma, or organ transplant. While each individual condition may seem rare, if you combine all of them, more than 1 in 500 people are affected by adrenal insufficiency, so it is actually not a rare condition. Adrenal insufficiency can be managed on a daily basis with oral glucocorticoid and mineralocorticoid replacement therapy. The most common glucocorticoid medications for replacement are hydrocortisone, dexamethasone, and prednisone, and the mineralocorticoid is fludrocortisone or Florinef. People without adrenal insufficiency can naturally produce up to 10 times the normal amount of cortisol during times of physical stress. However, patients who do have adrenal insufficiency and are treated with replacement cortisol cannot do this on their own. An adrenal crisis is an abrupt, life-threatening state caused by insufficient cortisol production. It can occur in times of febrile illness, vomiting, surgery, or serious injury or trauma. Immediate, appropriate emergency medical response can mean the difference between life, disability, and death. Some of the signs of adrenal crisis are pallor, dizziness, headache, lethargy or weakness, abdominal pain, nausea and vomiting, low blood sugar, low blood pressure, shock, heart failure, and even death. Because adrenal crisis is not always readily identifiable by its symptoms, CARES Foundation recommends that all individuals with CAH or any other condition associated with adrenal insufficiency always carry medical alert identification cards or wear medical identification tags to alert emergency responders to their need for immediate glucocorticoid administration. Additionally, CARES Foundation recommends carrying a letter from their physician describing their condition and treatment needs whenever traveling. And recent research has found that 75% of CAH-affected individuals do wear medical alert identification. Despite known treatment with hydrocortisone for an adrenal crisis, the mortality rate as a result of adrenal crisis or hypoglycemia has been reported to be as high as 24%, and preventable sudden deaths do continue to occur. You can compare this and contrast it to allergies, which has been shown to affect up to 15% of the U.S. population, yet the risk of death from an allergic reaction is less than 0.01%, and that's in great deal due to aggressive pre-hospital treatment with the EpiPen. The treatment of an adrenal crisis is equally simple with injectable hydrocortisone or Solu-Cortef. In those with adrenal insufficiency, rapid hydrocortisone administration during times of severe physical stress is vital to avoiding serious, potentially fatal complications. And the medication of choice is injectable hydrocortisone, as it provides both glucocorticoid and mineralocorticoid coverage. Solu-Cortef is vital to replacing absent glucocorticoids and mineralocorticoids in times of illness or injury at stress dose levels. And it works exactly the way normal cortisol would. In adrenally insufficient patients, the effective solu-Cortef is within minutes, and it is life-saving. The signs and symptoms of adrenal crisis can be similar to other shock-type presentations. For these patients, standard shock management requires supplementation with solu-Cortef. It's important to anticipate the evolution of an adrenal crisis and to medicate appropriately under specific protocols. Organ damage or death may result from delays. The administration of solu-Cortef can be given intramuscularly or as a slow intravenous bolus over 30 seconds. And the guidelines for dosing are as follows: 25 milligrams for infants, 50 milligrams for school-age children, and 100 milligrams for older children or adults. In summary, adrenal insufficiency is not a rare medical condition. Patients with adrenal insufficiency who go into crisis can rapidly deteriorate, and the mortality rates from adrenal crises remain unacceptably high. Treatment with injectable hydrocortisone is safe, effective, inexpensive, and life-saving, and it happens within minutes.
I'm Catherine, mom of a 3.5-year-old with congenital adrenal hyperplasia. We've been to the ER several times with him already, particularly during his first year of life. The feeling of stress and panic is so high when we are coming through your doors. We know that time matters when dealing with adrenal crisis. Thank you for the time you're taking today to know more about adrenal insufficiency, recognize signs of adrenal crisis, and how to quickly treat patients like my son. Thank you.